Welcome to eValue training for logging patient encounters. We are already logged into the eValue system and on the home page. We will now select the PXDX tile and add new. You will need to log each patient encounter for every day that you're in clinicals. Please note this is what you're logging for each patient. Anything that has an asterisk by it is required information, and the eValue system will not let you advance to the next page without submitting some information for these fields. So we will start by adding our interaction date. We will select our nurse practitioner core competencies. In this field, you can select all that apply. We will select our supervisor. We will select our course. We will then select our site, which should again be listed in alphabetical order, and we can make the selection from there. We will select our practice setting. You can only select one in this field, and for this example, we'll do Community Health Center. The practice type, patient initials, the time spent with each patient. What is the age and age group? Please select the gender, the ethnicity, and race. We will then put in our procedures and diagnosis. We have already uploaded several procedures and diagnosis, although the list is not exhaustive. You can select your diagnosis by group, or you can type in your diagnosis if you know it, or diagnosis code, and you will get anything related to that area. For the purpose of this example, we will select diabetes. What role did you play? Did you perform it? Did you assist, or was it observed? I'll select performed. You can freehand notes in this notes section if you like. And then you can add the procedure and or diagnosis. You can add as many procedures and diagnoses as you need to for each patient. You just must remember to select add procedure and diagnosis. Once all notes and specific information has been put in the field, you can then select save record. If for some reason you wanted to review and edit the record, you select review edit. And you can scroll down and find your patient from the 22nd, and you can either edit the record, you can delete the record, or if you like, just review the record. I'm going to go back to add new. You will then continue to add all this information on the patients who you are seeing. If you have 10 patients for the same site, you can create what's called a template. And I'll set that up for you. The template can be used per site. So you can create a template for each site in an effort to save time when inputting the information for each patient you are seeing. Remember, you must complete each field. If you leave something blank for a field that has an asterisk, you will not be allowed to advance. Okay. Heart failure is going to be our diagnosis, so you highlight the diagnosis. Again, your role, add procedure, and then if you want to use this particular template again, you can select Save as Template. You'll get a pop-up so that you can name it. And then you select Save. Do not forget to save the record. If you neglect to save a record, you will lose the information. To retrieve your template and make use of it, you will just simply select from the drop down and your template will appear. Just be sure to change the information that is specific to each patient. This concludes your eValue training for logging patient encounters.